You may not want to see this, but you should. Because this is what happens when filler injection goes wrong. This is called a vascular occlusion, and it occurs when filler is inadvertently injected into the blood vessels, which results in a lack of blood flow and oxygen to the skin, which could lead to necrosis or skin death if not recognized and treated early. This particular case is that of a woman who experienced vascular occlusion after getting filler injections into her smile lines. The smile lines are a particularly high-risk area for vascular occlusion because of the facial artery and its branches which course right in the area. Depending on which point the filler is injected into the artery, all the tissues in this area can become affected, and in rare situations it can even lead to blindness. Now, injection of filler into an artery is a very rare event, but it can happen to any injector from novice to expert. Experienced injectors take several precautions to minimize this risk, and if recognized and treated early, in most cases, vascular occlusions heal completely without any resulting complications, especially if hyaluronic acid-based fillers were used, which are dissolvable and reversible. So what happened in this particular case that took this woman from this to this? In reading up on this case, I think the main factors were that the vascular occlusion was not recognized quickly enough, nor was it treated quickly enough and appropriately. The filler that was used was also a non-hyaluronic acid-based filler, which was not reversible, so you couldn't dissolve it. That's one of the reasons why I only use hyaluronic acid-based fillers, especially in higher risk areas. So basically, she just had to wait it out, and it got to the point where her nostril actually died and fell off. And now she needs a prosthesis. And though the rest of her face did heal, as you can see, she was left with some permanent scarring. Every injector should warn their patients of the risk of vascular occlusion during filler injections, along with the signs and symptoms to look out for after your treatment. But I've had countless of patients that have come see me after being treated elsewhere that were never informed of these risks. Did you know this filler risk existed? Let me know in the comments and share this post to raise awareness.